So with that, Carl, I am going to hand it over to you.
Okay, good afternoon, everyone. Thanks for joining us for this Alomere update. And just want to, I will start by sharing my screen, but I hope that everybody is having a good holiday season so far. And one of the good things that I shared this morning is that we only have one more week left until the days start getting a little bit longer. So that's something good to be looking forward to. Let me see here now. I just want to get into slideshow, and we'll get started this afternoon. We have a couple of our physicians, so all of our physicians today are busy working today as well. So we really appreciate their time that they're taking to spend with us today. Let me see. For some reason, it's not allowing me to go to slide view, but hopefully, can you see I guess the first slide here on the presentation?
Yep, we can see it.
Okay, great. I'll just start with our mission. It's our passion and purpose is to strengthen and nurture the health and well-being of our family, friends, neighbors, and communities through every season of life. And that couldn't be more critical than it is today, and it has been for the last year as we've been dealing, well, actually almost 2 years now, as we've been dealing with the COVID pandemic. Today we have Dr. Mitch Gesell, as Lauren alluded to. He's a board certified emergency medicine physician. He's been with Alomere since 2017, born and raised in this community. So many of you, I'm sure, know who he is. And then Dr. Jayme Danielson is an inpatient hospital medicine physician. So he is full-time working in hospital medicine, and he is board certified in internal medicine, and he's been with Alomere Health since 2013. And Dr. Deb Dittberner, who has been with Alomere since 1995 as our chief medical officer for the organization for the past several years. And so I have the privilege of working with all of these physicians in our organization. And Dr. Dittberner is currently the president of the Minnesota Academy of Family Physicians as well. We start off every meeting with value sightings in the organization, or we try to start off with every meeting with value sightings. And I just want to share with you a beautiful letter that we just received this week that I think is a great way to kick things off here today. As much as we may be talking about the gloom of the situation that we're in right now, it's always great to highlight the positive things that are happening as well. This was a patient from Monticello who was transferred to Alomere, went into the emergency room in the Monticello hospital. He said, I went to the Monticello ER with COVID. My oxygen level was such that the doctor said it was very serious condition and it needed to be in the hospital immediately. And they didn't have any beds available, so they searched all over to find a bed for him. And fortunately, he said a room became available at Alexandria Hospital. One of the first things I remember was the visit with Dr. Dulsing. I was astonished that he was willing to spend significant amount of time with me explaining my condition. He gave me hope without giving me unrealistic expectations. I absolutely loved his honest approach. Wednesday morning when he came in, he had me call my wife on the speakerphone so he could explain the situation to her and take the time to answer questions that she had. The nursing staff was also excellent, although I was in isolation and they had to completely gown up. They were extremely friendly and helpful. They constantly made sure I had whatever I needed. The level of care given by the nurses made me feel like I was an honored guest, seriously. Then, of course, there was the food service. Oh my. I told them they were feeding me so well that I was going to have to go on a diet when I went home. And then they said the next Monday, Dr. Alakris became my doctor. He was willing to take the time in his busy schedule to answer questions and was delighted. And I was delighted when he pronounced that I was no longer infectious and asked if I wanted the door to my room opened. Yes, he was very thorough. Your hospital is an amazing place that although I was in there for a very serious condition I will always remember with great appreciation. So again, it's wonderful to get those great stories of people that actually walk out of our facility. We had a patient that walked out of our facility here a week ago after being in our facility, I think for 35 days. I know our physicians will be talking about, just the experiences that they're dealing with in the facility. I also want to just start here as well. Lauren, I know your slide talked about better together, and that couldn't have been more fortuitous when you think about the COVID situation that we're in and the theme of our Alexandria Lakes Area Chamber of Commerce. And the challenge I want to put out to you and what will be our focus as an organization next year is really how do we get back to better together? Because honestly, I think we've taken a lot of steps backwards relative to a society in terms of how we really work together. It's certainly our focus is that it is better here at Alomere Health. It's better here in Alexandria. It's better here, in our region, and we want that to be true, truly something that people can believe. So if you're interested in talking with me further about that, I would encourage you to reach out to me, and you can either find my contact information online or I'll have it at the end as well. The last thing I will say before I turn it over to Dr. Dittberner is just, as an organization, we have a rich history of providing excellent care, and that's the pride that our staff, our physicians take in that is extremely serious. And I have heard more now than ever how our physicians, our nursing staff, all of our staff in the organization feel like our patients aren't getting the right care at the right time in the right location. And it's because of the challenges that they're dealing with on a day in and day out basis. And so it really is painful for them to really feel like we're not living up to the expectations that we hold ourselves to normally in a normal environment. So Dr. Dittberner, why don't you share the state of COVID and what's happening currently? You'll have to unmute yourself.
How many times has that happened in meetings in the last 20 months, huh? So this is something I've done. We started meeting as a health system and updating within the health system, and then eventually to the public in the beginning daily, and then it went weekly. But it started on March 4th, 2020. Seems so long ago, almost 2 years now. But on that day in the world, on March 4th, we had just 214 deaths in the world and 35,000 cases. Now we're up over 270 million cases of COVID and 5.31 million deaths. In the United States, on March 4th, we only had 2 deaths. And in 1 year, we've gone to over 800,000 deaths in the United States from COVID. In Minnesota, at that point, we were just aware of COVID. It had hit out in Oregon and in Washington and out in New York. But we had 0 cases and 0 deaths here. But today in Minnesota, we've had 960,000 cases and now almost 10,000 deaths in the state of Minnesota from COVID. And in Douglas County, of course, it was 0 and 0, but now we've had 101 deaths, and that will be climbing after what we've seen in the hospital this week. Interestingly, Douglas County is about 37,000 people that live here. Cook County, up in the northeast corner of the state with just 5,500 residents, has had 1 death, and they are 83% immunized. We haven't done a bad job here in Douglas County immunizing. If you look at this picture, this shows you the United States. The darker the green, the better the immunization rates. And you can see where Minnesota has been a leader kind of in the Midwest, along with Wisconsin and Illinois, in immunizing with at least 1 shot. But we have states around us that are slower to take that up. And then when you dive into Minnesota, now you can see Cook County again up in the northeast corner and how dark that is with 83% uptake. Cook County has had one COVID death in 5,600 people with 83% uptake and good mitigation. If we extrapolate our 37,000 patients to that, or 37,000 people to their 5,500, if we had done the same measures that Cook County had done, we would have 7 to 10 deaths instead of 101. So just something to think about. Here's diving into the Minnesota Department of Health data. And now if you go look at the bars on the left side and go down to Douglas County, you can see the state average is the orange dotted line that goes vertically, and you can see where we are. Even though we're a shining star in West Central Minnesota with our with about 6% vaccinated, we still have a ways to go to get to the state average. And the state average right now is about 66% of people that could be vaccinated, or 66% of the population are vaccinated. That includes the children 0 to 5. If we excluded them, the best we could do is about 91, 92%, but we still have a ways to go to get there. Next slide. I want to talk a little bit about Omicron. That's what you're all hearing a lot about. We're in the middle of a Delta wave. That's the major variant here in Minnesota right now, which is a case that spreads about 5 to 6 times more easily than Alpha, but makes you much sicker. And that's why in a little bit, we'll hear from Dr. Danielson and Dr. Gesell about the age of the patients that we're seeing and the severity of the illness that we're seeing. Omicron evolved in people that were chronically sick with it, and it has 50 mutations and over 30 mutations on those spike proteins that come off. And those spike proteins are really the key to get into our cells. And so it modified it, making it easier to get into our cells. And so we know that in a room of 50 people, it would take one sick person to get everybody sick in that room because this one is so contagious. The good news is it may not make us as sick. However, it will make more people sick. Therefore, we're thinking right now, our hospitalizations will still be high when Omicron gets here, if not higher than right now. And I'll explain that a little bit more. There's been a lot of updates coming out of the UK, knowing that boosters improve your chances to not be susceptible to Omicron. A booster is the 3rd vaccine that you would need in the series. Right now in the United States, only 14% of the immunized people have received a booster. So we have 86% of people that could get Omicron again, perhaps mildly, but be able to spread it to that 36% that has not been immunized yet. So this is why this getting vaccinated and getting boosted is so important. And right now in the UK, the lines are 6 hours long to get their boosters because they just started boosting and they now have Omicron as the major variant in the United Kingdom. So they're just racing to get everybody boosted. Next slide. I also want to talk to you about some of the work that keeps us busy. You know, we talk about how stressful it is in healthcare right now. And one of the things we've had to do is really stretch ourselves to do more, not only to take care of more people, but to do more. And doing more means testing people. We've got a test site that is testing between 100 and 200 people a day. And we're giving monoclonal antibody every day for our area. Monoclonal antibody, what we like to think about in medicine is there's active immunity and passive immunity. Active immunity is when you get the disease itself or you get a vaccination. That's active immunity. Passive immunity is when we boost your immune system by giving you antibodies, and that's what monoclonal antibody therapy is. And then with Delta, you know, you're all hearing about people getting sick with Delta, or that people that have been immunized can get Delta, or people that are immunized can get Omicron. And what's happening there is there's a lot of people that are getting it that are not symptomatic. And that's what we call infection versus disease. I'm fully immunized. I could get Delta. I could not have symptoms. If I don't protect others by wearing a mask, keeping my distance, I can give somebody that's susceptible, somebody that hasn't been immunized, or somebody that has an immune compromised system, I can give them the disease. The disease is where you have the symptoms. So when you hear people talking about the need for mitigation, for good ventilation, distancing from each other, trying to stay outside, and then masking or testing before we gather, that's all about the infection versus the disease. Fortunately, monoclonal antibody therapy has worked wonderfully against Alpha and Delta, the two main strains we've seen here in Minnesota. But we're not so sure it's going to work for Omicron. We do have one new monoclonal antibody that I've listed here. It's called sotrivimab from GlaxoSmithKline that will work against Omicron. But with that many people sick, it will be a tough thing to effectively give. When we give monoclonal antibody here at Alexandria Clinic, we give 8 per day. It takes one full-time nurse to coordinate and educate and get all the patients lined up, and one full-time nurse, RN, to give the monoclonal antibody therapy. So it really taxes our system. Right now, we're doing it Monday through Friday. Our hope is that we can grow that to even a Monday through Sunday option. For all of you that are listening, if you get sick with the disease, you're tested and you have a positive test, then you should consider if you're a candidate for monoclonal antibody therapy, and you can do that through the Minnesota Department of Health website. And I encourage every single day my patients and all patients to check into that if you get diagnosed, so that we can prevent hospitalizations. We know that if somebody takes monoclonal antibody therapy within the first 10 days of having symptoms, that we can prevent 60 to 70% of hospitalizations. And I'll put money, Mitch, or Dr. Gesell and Dr. Danielson will talk to you about people that come in late, that don't get tested, that don't get a chance for monoclonal antibody therapy, and then they're hospitalized, and how we would love to prevent that at all costs. Next slide.
Okay. All right, I will very quickly cover a few more background information to kind of set the stage for some additional discussions with our physicians that are on here. This is a chart that just shows the statewide hospitalizations. You look back in December of last year, there were over 1,800 patients hospitalized in Minnesota hospitals. We're again gradually getting back to that same level again this year. And I think our physicians will say that it's much worse this time around than it was previously, or at least feels a lot different. We were in July down to 97 total hospitalized patients in the state of Minnesota. Just in the last month, we've had a 67% increase in inpatient hospitalizations. These are a couple of dashboards that a couple of larger health systems put out to really show the impact of the vaccination or the unvaccinated are largely 75+% of those that are being hospitalized with COVID. In our facility, we just ran some numbers. It's 79% of the patients between November and December here recently were unvaccinated patients in our facility. Also the transfers as a facility, I shared the value citing story earlier. Not only are we transferring patients longer distances and so forth, but we're accepting patients from a lot further, very unusual situations compared to what we normally would experience. This is also a graph that shows that the projected cost just from June to August. The estimated cost of preventable hospitalizations for unvaccinated population, and they used roughly $20,000 per admission for hospitalization, and they used a percentage of the unvaccinated that could be potentially avoidable hospital admissions. So just in that 3-month period of time, they're estimating that the additional cost of the healthcare delivery system was $5.9 billion. across the United States. That will eventually hit the premium costs for the insurance market as well. Just a few more updates on the COVID situation update across the state is the National Guard has deployed response teams, 50 to aid in staffing of long-term care type facilities, New Hope, Onamia, Fergus Falls. There's been a FEMA team, 16 personnel from FEMA now who have been deployed across to different sites in central Minnesota to assist with monoclonal antibody treatments Dr. Dittberner referred to. The severe shortage of ICU and med-surg bed availability causing difficulties with transfers of patients to higher level of care. Again, referring to getting the patients to the right care, the right time, and the right location is extremely difficult. High pressure on staffing positions across the organization, both COVID and non-COVID. There are roughly, because of the shortage in nursing homes of beds, there have been on average up to 900 patients that are sitting in beds in hospitals that are waiting for discharge to nursing homes, but there aren't beds available in the nursing homes. And yet there are the challenges of facilities accepting acute admissions to the facilities is somewhat limited by, again, those beds being occupied by patients that could be discharged. Self-imposed, we have imposed a 50 to 70% reduction in our surgical cases to ease the pressure on our staffing and our inpatient census. We're admitting 7+ patients per day through our emergency room, and not just COVID, but all kinds of admissions. We're boarding patients in the ER, that we don't have beds available for, or we can't find a bed for transfer. The disruption of ambulance services. We had one evening where we had 2 transfers that in ordinary circumstances would have taken the ambulance crew out of our community for 5 hours. And that particular night, it took 15 hours because one patient went to Duluth and the other went to Mayo. The positivity rate, the good news is somewhat that the positivity rate has come down in the last week to 2 weeks. It was around 23% about a week and a half ago. It's down to the most recent numbers that we're seeing is 16%, but it was as high as 40+% positivity rate. We're having challenges with employee absences for quarantine. We have at least 30 employees roughly that are out for absences. I refer to this as on game day, who can play, like in the football team, who's eligible to play is that we oftentimes have staff that either test positive or they're off with their kids because they have kids that are testing positive and so forth. We have 70+ positions in the organization right now that are vacant. And the last slide that I'll just share is just this, is the situation is really in a crisis situation right now. This left side of the graph shows an article that was just published in the Star Tribune this last weekend by the 9 metro or large health systems in the state, basically talking about, how heartbroken, overwhelmed, what a critical situation it is right now in terms of getting, again, the patients the right care, the right time and the right location and so forth. And just a plea to people to get vaccinated, to get your boosters and wear your mask, social distance, and encourage your neighbors and loved ones also. On the right side, this was an article recently that came out that talked about 1 in 5 healthcare workers, physicians and staff have left the healthcare field since February of 2020. 31% of those that are left have thought about leaving healthcare. Some of the top 3 reasons are many believe that the vaccines would ease the trauma endured by the initial surges. Number 2 is that the COVID patients in some cases are becoming more difficult to deal with. There's much more resistant to medical procedures or belligerent, and in some cases very and somewhat verbally assaulting to nurses and doctors in terms of threatening to sue them. We've had situations like that, right here, threatening to sue for not giving non-FDA approved treatments for patients. And then third is just that providers are just exhausted and they're not exiting the field because they can't handle their jobs. They're quitting because they can't handle being unable to do their jobs, is that they feel like, again, that pride that they feel in what their the care that they provide and being unable to do that. So let me stop there, and I will ask both Dr. Danielson and Dr. Gesell, if you could just start by describing the current situation and what feels like for you right now as a provider, working on the front lines.
Yeah, thanks, Carl. Can you guys hear me okay right now?
Yes.
Okay. Hi, everybody. It's Dr. Mitch Gesell. I'm actually chiming in from the ER today. Kind of been a busy day for us, so I'll be brief, but kind of wanted to give everyone just a little perspective, more of a personal kind of experience of how we've been doing the past several months, and kind of just what the ER has been like most recently. To say the least, I think Carl used a good word to describe it, crisis, I would say. I mean, it's been really tough. We're all working extremely hard. Our doctors, nurses, and staff right now, I think we're kind of stressed out to the max. And coming in this morning, just to give you kind of a feel for what the days are like, walking into several patients that have actually been here since yesterday. These are sick patients that are in need of a higher level or an ICU bed that we just don't have here. And quite frankly, we don't have anywhere in the state or region. So it's frustrating and a lot of things right now. We wish we had the hospital beds for these patients. But kind of just walking through over the last several months, we've seen increased ER numbers just in the wake of this Delta variant. People are more sick, and not only that, I think Deb was touching on as well that we're seeing a younger unvaccinated crowd that's coming in with COVID. And a lot of these people are getting admitted. A lot of our ICU beds right now throughout the state are being occupied by COVID patients. And of those COVID patients, I think we identified a large proportion of them are actually unvaccinated. So it's frustrating when we know that a vaccine is in many ways preventable for some of the serious illness and hospitalizations. And it's directly affecting our community on multiple levels here. We have not only within our hospital, but as Carl was mentioning, kind of on the pre-hospital setting, our EMS teams, we're having to transfer patients as far out as Bismarck, North Dakota, down to Sioux Falls, maybe, and looking in the Rochester, Mayo direction as well, and into Wisconsin. When we have our rigs, taking sick people out that far, that's kind of a lack of coverage within our community. And that would include just regular 911 calls that we're kind of, struggling to cover. So not a great situation overall in general. But the biggest thing right now is the lack of available beds. When a patient comes in and is sick, and whether that's for, saying having a heart condition or needing a special treatment like dialysis, or a specialist, a surgical specialist, for example, we're often on a normal day, calling a hospital such as St. Cloud, maybe down to the cities and getting that patient transferred to a higher level of care. We're just not unable to, or we can't do that right now because they don't have beds available for us. So as a patient, and what that means for our community is you may be in the emergency department and, maybe kind of staying with us for a while. Like I said, coming in this morning, we had patients that had been here for over 24 hours. That's not ideal for anyone. It's an extra strain on our staff. Now we're taking care of ICU level patients in our emergency department. That's taking away, my nurses that I would have on a normal day for every other emergency that comes in. So if you're having a heart attack right now, coming in, we're already stressed to the max. So I can't say enough, kind of a lack of words right now as to the current status of the ER. Certainly this is, I guess, probably one of the worst days that I've had as a ER provider in my entire career. I guess, and falling on the day that I'm coming to talk with you guys, I guess appropriately so. So I can't emphasize enough that we're not in a great state right now.
Thanks, Dr. Gesell. Dr. Danielson.
Hi there. Thanks. And I would echo a lot of what Dr. Gesell had voiced. I think this wave has been more difficult in a lot of ways. One, the just duration, last fall certainly had a quick spike, but then the decline was pretty quick within, 6 to 8 weeks. We were largely past that large wave. And I think the difficult part now is, knowing that, anywhere from 80 to 90% of at least COVID-specific hospitalizations could have been prevented. And that I know it's become a highly charged topic to even discuss, even vaccination, which is unique in the 10 years I've been practicing. And that's difficult, and we certainly never want to interject politics or personal choice. We believe in that, but just to emphasize the effectiveness of the vaccine as far as preventing hospitalization and death. It's frustrating and discouraging to see breakthrough cases of people who've been vaccinated getting sick, but by and large, if you're going to take just a random 10 patients out of the hospital, 8 to 9 of those are going to be unvaccinated. And that's not to blame them or to say they don't deserve care. We still provide care to those like we do any other patient. So they're still getting the exact same care. But there are limits to what the healthcare system can provide at one time. And we're all tired of COVID. Believe it, I don't think any of us wanted to be at this point, this far into the pandemic, of where we're at. We're all tired of talking about it or seeing it. And believe us, we all wish this was in the past. We take no joy in perpetuating the seriousness of the pandemic, but we have to be honest in where we're at. And also, I think, the last couple months has been a lot of younger patients. Last fall, it hit our nursing homes very hard, and a lot of loss and trauma to those staff and those families. But this time, it's not common for us to treat patients in their 30s and 40s that are, thankfully largely surviving, but not all. And the best case scenario, they're in the hospital for 2 weeks, out of work for 4, 6, 8 weeks. I've never written this many short-term disability or medical leave paperwork in the last 3 months than I have, the last 10 years combined. So, the impact, we sometimes focus on the mortality rate or how many people are dying of this, which is tragic enough. But I think the impact that it has to our workforce, our communities in general, our caregivers of parents, it's really taking a toll as far as that. And I think, the two things, and this is, again, it's just looking at where we're at, and what we know that works the best is prevention, and that being vaccines. We certainly know the burden of that social distancing and that creates, and we don't expect people to shelter forever. But the thing is of getting vaccinated and then living life following that. So that's just kind of where we're at.
I will come back to both Dr. Gesell and Dr. Danielson to just talk about, again, they have patients that need a higher level of care and so forth, and both on the ER and the inpatient side. And that, it's our physicians, we have excellent physicians here, but they also, in a normal environment, there are certain things that patients should be in a different setting for, or a higher level of care for certain conditions and so forth. But because of the circumstances, they are often caring for a lot of those more critical patients here because we can't find a bed. And whether that's every day trying to call the facilities to find out, is there a bed now available, 24 hours later and so forth. But Dr. Dittberner, do you want to talk about, your perspective on this in terms of what it feels like?
Yeah, I think we're seeing the same frustrations at the clinic level too, with sick patients coming into express care, doing, visits by telemedicine. and trying to get those patients over to the clinic. But, you know, one of the things that Carl and I and Margaret have spent a lot of time on over the last month to 6 weeks is really these emergency conferences. And I'm just going to tell you a little bit about Dr. Gesell and his worst day ever. This morning, you know, he got there and had 4 patients that needed higher levels of care, but couldn't get anywhere. So he texts me, I call Margaret and Carl and the ER director, and we all get on the phone together to try to figure out a plan to help Dr. Gesell and help patients get to where they need to go. And we did some pretty creative things this morning, but this is happening every 2 to 4 days, if not more than that. It can happen at 2 a.m. It can happen on Saturday night at 8. It can happen at Sunday morning at 9. And it's not just the ER that we're helping do that, but we're also helping the hospitalists when they start to have patients that crump and they need to get patients somewhere and the hospital's full. Then we all have to pitch in our resources to help them get patients out also. So it's taking a lot of resources to do that. And as a chief medical officer, I just want you to, you know, Margaret and Carl and myself really see it in our healthcare workers right now, just the burden they're carrying right now, and really trying to help them keep their resiliency up. And, you know, you already heard from Carl about how many healthcare workers have already left healthcare long before the discussion of mandates. And this is really going to be a crisis in the healthcare world, even moving forward, if we don't take this on as a community and help these healthcare workers.
Thank you. I don't know if Dr. Gesell is still there, or Dr. Danielson. If you want to talk just briefly, what are some of the, you know, when you think about having to take care of patients here, admitting patients to the ICU here because there isn't a bed available, and maybe it's even temporarily until that we continue to call around to other places. Anything more that you would like to add, you know, relative to that?
Maybe I can start with that, Jayme, and pass off to you, but it's not ideal on both ends. I mean, in a sense, we're trying to make exceptions and take care of the patient the best we can with the resources that we have. But many times, you know, that we're not kind of getting the definitive care that a patient may need. You know, in many situations, we're in a tough, you know, area where we really need to get them down to a higher level of care where they need that specialist, or say need something like dialysis, which we can't provide here. It's been, you know, a tough process, and sometimes getting them to an ICU just even here. You know, we can provide some services, but overall it involves multiple phone calls. You know, it certainly is acting in the patient's best interest, but, you know, the best thing for them would be the bed that they don't have, you know, so we just can't provide them that level of care, which can be frustrating. So in many ways, you know, it's still frustrating. It's still a major time consumption and resource consumption on both ends, you know, and the doctors, the ICU team, you know, has been great in accommodating us with certain needs and trying to keep the ER free for obviously the rest of the community and for the other emergencies. But that in itself, you know, kind of just creates a perfect storm, because then we, you know, are tying up other beds and can't kind of get our resources directed, you know, the way we want to. Anything you want to add on that, Jayme?
Yeah, I think that's been unique to these last, you know, several months, and then for a couple months last fall. Just the inability to transfer a patient with certain types of heart attacks, or those needing dialysis who have kidney failure. So, and that weighs pretty heavily on physicians. We want to, and nurses, we want to get the best care they deserve, and that's been more difficult now. And it's you know, might be spending a couple hours on the phone calling around to 15 different hospitals multiple times a day, trying to get that patient an ICU bed. So that's been difficult. And you know, there was a comment, I think, in the chat about perpetuating fear and anxiety, and certainly that is not our goal. We had a really good summer locally, and no one wants us, you know, to be in a better spot or to not talk about COVID than us, believe us. It's the bottom line is, and it just doesn't It's not an agenda. It's just looking at any disease that would occupy 30, 40, 50% of our hospital beds at any given time. We'd be out here talking to the masses about doing what you can to prevent that disease. And in this case, the science is clear that that's vaccination.
Hey, Jayme.
Go ahead.
Can you, one of the other questions was the average age. We know that the average age is about 17 to 20 years younger than the previous wave that we had last November of hospitalized and people sick in the hospital or people dying is 17 to 20 years younger. Can you give, I know the numbers well, and that people that are immunized that are in the hospital are usually very elderly or have other comorbidities. But your comment that you've said numerous times about under age 65 hospitalized.
Yeah, that's our most common, is actually those under age 65 right now. Probably off the top of my head, just going over the last couple of months, I would say 2/3 of patients are under the age of 65 this time. So that's unique in a lot of conditions. These are patients that have a lot of them never been hospitalized a day in their life. So get asked a lot about underlying conditions, and certainly that increases your risk. But, realizing that the majority of adults in America, myself included, have an underlying condition of just having an elevated BMI, being overweight, that in itself is an underlying condition that in COVID specifically significantly increases your risk.
But Dr. Danielson, the under 60 age group, people that are hospitalized, vaccinated or unvaccinated?
Again, and this is just to illustrate effectiveness of the vaccine, not to blame a group, because I think there's a lot of, unfortunately, not great information that's easily accessible out there. But 0 under the age of 60 have been vaccinated, and that's at least, I would say, 100 patients. No breakthroughs have been hospitalized.
I think I just kind of want to go back to that question too about, perpetuating fear and anxiety. It's certainly not our goal here today to perpetuate fear and anxiety, but it is our goal to really help the community understand how it's affecting, how this COVID situation is affecting our staff and our providers within the facility on a day in and day out basis. We are living in two worlds as an organization and as individuals in our organization. When I'm here in the facility, it's a completely different world than what I walk out in the community in Alexandria. And I don't know that, and part of what we want to try and at least try to help people understand is that is the reality of the situation that we are in as a local healthcare provider in our community. And it's often hard for our providers and our staff who are leaving our facility, when they know what they're dealing with on the inside of the facility, to go out and to see that really, to a large degree, COVID doesn't exist outside the walls of our facility to a large degree. And I think that is somewhat maybe the frustration, the kind of hopelessness and so forth that maybe our providers are feeling right now. So certainly not trying to, perpetuate fear and anxiety. So anything to add to that? Okay. So I know that, the other thing that we've had even conversations, Dr. Dittberner talked about even those, what we call crisis standards of care conversations, that anytime any physician, any nurse, anybody feels like there is a situation that we need to have a huddle about, to talk about what are we going to do, because, what we are trying to do isn't working and so forth. And in some of those situations, it's even come to end of life care conversations and so forth, that probably in ordinary circumstances, because we can't find beds, we can't transfer patients and so forth. Those are some of the things that are happening all across the state because of the limited number of beds and staff that are available in the facilities as well. Anything to comment on relative to that, or those, how you're handling those situations?
You can go ahead, Dr. Danielson.
Sure. That's been something that's been brought up, and each hospital has ethics committees, and what do we do when periods where you're at least you have to prioritize and triage patients based on acuity and level of care, and we don't let that affect. We still strive and give every patient that the best care we can and the care they need. And we don't necessarily, we're not withholding care to patients that need it and desire, but certainly it's forced some difficult decisions as far as which patient gets an ambulance transfer first. You have 3 patients that need it. So these are happening now, and there's it's not just COVID, it's complex, but certainly I think just losing people in the healthcare professions, because it's stressful. And I think what's different is, and I know there's strong support out there, but I think last year there was a lot more community unity towards in support of healthcare workers, and this time it feels more adversarial. And I think the most important thing in a healthcare providers and nurses and thing that we base our relationship on is trust. And that's really tough to get back when you lose it. And certainly we don't expect blind acceptance. We don't know everything, but we've spent years and most of our lives, to this. So that's probably the most difficult part right now.
Yeah.
Is that lack of trust.
Yeah, I think it goes back to that wonderful slide you had, Carl, that, talked about, why we came into healthcare and what it's feeling like right now. And that's where we're really struggling.
Are there any other questions in the chat? I don't have access to that, but Lauren, do you have other questions that you would like us to address?
There was one question about if we're updating elected officials, and I know that our county commissioners sit on the hospital board, and I think Carl has done an exceptional job of educating them.
And I know that even at the state level, run into Senator Ingebretson periodically, and he asks how we're doing and, what are some of the challenges and issues that we're dealing with. And so we've had certainly very open dialogue and communications there as well. So it's been certainly the help that the state has come forward with through the FEMA teams and so forth have been really helping to strategically kind of target certain parts of the state that may be struggling more than others. And our inpatient census today, I think, is roughly 45% roughly of our inpatients in the facility today are COVID inpatient admissions. We're limiting our surgical admissions. Today we have 5 surgical admissions that we are operating on, probably more urgent or emergent types of surgeries. But again, we have expecting 6 to 7 emergency room visits that will come in today as well into the facility. And of course, Dr. Gesell is trying to find placement for some patients as well that have been in the ER at least for 24 hours already.
Yeah. One of the other things that we do every day, in fact, I have to do it today again at 5 o'clock, is we have statewide and regional meetings where hospital chief nurse officers and chief medical officers get together and talk about, share what our patient census is, share who's got openings, who doesn't have openings, so we can kind of try to move those patients around the state. The one is the C4, which is the Critical Care Coordination Center put up by the University of Minnesota, and all the hospitals participate in that every day at 11 o'clock, where we get updated on how many COVID patients are hospitalized and how many are on ventilators and how many are in ICUs and how many beds are available at the larger health systems. It is what I would call a grim call every day. And then we have one that Center Care organizes every other day, and sometimes on the weekends, where all the regional hospitals, so you can really hear what's happening at, let's say, Tri-County Wadena or Stevens County, Glenwood, Staples, and hear what's happening at those hospitals too, and try to help them out getting patients moved around the state of Minnesota.
Shared a little bit of feedback in terms of things that you can help us with, in terms of getting vaccinated, getting the booster, encouraging your neighbors and your loved ones to get vaccinated as well. I just want to wrap things up. At least if there are more questions, we can certainly come back to them. But this whole theme of better together, I think, again, is an extremely valuable thing for us to be focusing on, not only in our organization, but in our community, in our state, in our country. And we as an organization, take great pride in the fact that it is better here. I think the recognition that this organization has received historically, both nationally and regionally, speaks for itself. And it's 100% attributed to the physicians and the staff in the organization that commit to living our values on a day in and day out basis. Our values of accountability, compassion, excellence, hospitality, and integrity is what drives every single decision that we make, whether it's relating to the care that we provide to the patients or the decisions we make relative to, our staffing, our strategic operations, and so forth in the facility. But those values will continue to drive us to be able to continue to serve you and provide you the very best care in the future. But if you are interested in having further conversations, when I think about our passion and purpose to strengthen and nurture health and well-being, it's health and well-being is more than the medical care that we're providing in our facilities. It's spiritual, emotional, physical health, mental health, and so forth. And so starting a dialogue, bringing people together to talk about how do we really accomplish what we want to accomplish in terms of that theme of better together, and heal some of what unfortunately the circumstances have caused out of COVID. So Dr. Danielson, Dr. Dittberner, Dr. Gesell, thank you all three for joining today. Do you have any final comments?
Yeah, I'd like to thank everybody for participating. And I know this is, a relatively darker time, but I think that better times are on the horizon. We can't control the virus, but certainly just staying emotionally available and connected. I think human interaction is important, but protecting yourself. And the good news is that, immunity from vaccination, even prior infections, is hopefully going to help reduce the severity significantly. I think that's really the main thing, and focusing on your personal, emotional, spiritual health, physical, exercise, good diet. Those are all still things that that do help significantly for everything. So not to get just focused on COVID. There are other things out there, but that's just kind of the dominating right now, at least as far as healthcare. So
thank you.
Yeah,
Dr.
I think that we're better together, and we need your help right now in getting this message out that we shared with you today, so that people stay safe, that people do get vaccinated, and that people do take precautions, so that we don't spread more of the virus than we have to. And it will get better, but we need to do it together.
Well, I'm just looking at the comments, and you can probably see me with the sharing the screen, but maybe you can't. But thank you for your feedback, and thank you for participating today. And we really appreciate our community, and just want to can't thank you enough for your support and for your prayers for everybody here. But hope you have a wonderful holiday season. So Lauren, I'll turn it back over to you.
Thanks, Carl. Yep, as everyone, as you've seen in the comments, on behalf of the chamber too, we thank you, get presenters and all of our healthcare providers for all that you guys are doing in our community in this trying time. As stated at the beginning, this has been recorded, so this will be on our chamber website later today. That's alexandriamn.org. I will put that in the comments. So that will include the slides as well. So for those of you who want to tune back in and watch this again later, or if you know others who didn't get a chance to tune in, that they can see that as well. So thank you all very much for listening in.